Thank you, Vimla. Thanks for joining, everyone. If you just give us a couple of minutes, we'll just wait for more attendees and we'll get started within the next couple of minutes. Hi all, just for the ones that have just joined, we're just waiting for a couple more people to join and we will be starting shortly. Hi Sybil. Okay, Dr. Rajeeb, if you want to just share your slide, just the kind of the first page, and we'll start shortly.
Yep, I can. I hope you can see the slides now.
Yeah, we can. So let me just check if there's any more attendees. Okay. Thanks everyone for joining us today. We'll be presenting a session on MSc Global Public Health with Dr. Rajeeb. And over to you, Dr. Rajeeb.
Oh, thank you. Thank you, Simeon, for introducing me. So I'm Rajeeb Kumar Shah. I'm the Program Director for MSc Global Public Health at Canterbury Christ Church University. I'm really delighted to talk to you all attendees here who are looking forward to study with us or thinking of global public health career in general. So welcome everyone. I will start the presentation and I will try to give you a little bit of insight about global public health, about a little bit about the course, about Canterbury Christ Church University itself, or where the course sits, and what you can do after completing MSc Global Public Health. And then I will be happy to answer any academic related questions. And if there are other questions, I'm sure colleagues will be here to answer those questions as well. So yeah, we'll try to answer as many questions as possible. First, let me start by telling you a little bit about myself. And I'm sure many of you will have similarities with my career, in initial part of the career, at least I will say. So as I said, like I'm Rajeeb, I am originally from Nepal, and then I completed my medical degree in Georgia. So I'm a medical doctor, and that is the similarity I was trying to draw in. I'm sure that many of you who are attending here may be medical doctor or healthcare professional. So yeah, I'm a clinical background, and then I came to UK to complete my master's degree, and I did MSc in public health, and then I completed my doctorate, PhD in public health at Canterbury Christ Church University. And today, I was part of a lecturing team, and now I am leading this MSc Global Public Health program at Canterbury Christ Church University. So you can see my trajectory in terms of like how thinking about public health, and how if I was sort of like thinking where I can do a healthcare job, not only in hospital, but also the hospital, then how public health has helped me to be here and speaking to you all. So I will tell a little bit more about that in the process when we go through. So first, let me tell you about this MSc Global Public Health program. And as I highlighted, the role of healthcare professional doesn't only sit in the clinical setting, in the hospital. It is much beyond that. And if you want to just take an example, just take example of what is happening with coronavirus. I mean, of course, healthcare settings are overwhelmed, but we can see that coronavirus is not only as a result of what is happening within the healthcare system, but also what is happening into the wider community. And that is the key part of global public health, what we try to bring in within this course. So the aim of this program is to make sure that it is interdisciplinary, where we talk about healthcare issues, disease, but also talk about what comes because of healthcare issues. So where does this disease comes from, and how we can tackle it, not only in the hospital setting, but in the wider setting. And that's where we bring in the interdisciplinary component to embed the research and the scholarship within our program. And that is the main part of this program. The second thing is, like, we try to link as much as with the health industry stakeholders, our various local stakeholders, like our local council who provides the healthcare services at within this particular region, and so on. And that is one of the key parts of our program, that we try to link up with our local stakeholders so that students can also get some form of practical experience. When I say practical experience, we do not have the placement as per se within the course, but then we try to try to motivate the students to look for the opportunities that they can get work experience as. And we as a team support students on that, so that they can develop their skills and they can be good for the employable in terms of, like, when they complete their degree. So that is the one part of our program. When I talk about the history of this program, we have been delivering the public health program for more than 30 years now. So it is not a new program, but it has a wholesome history of delivering the program. So we sit within Faculty of Medicine, Health and Social Care, and we have got two schools, and we have got all sorts of other programs. But public health and health promotion is one of our biggest programs within our School of Allied and Public Health Profession, where we deliver undergraduate BSc, that is BSc Public Health and Health Promotion, and the master's program, which is MSc Global Public Health. Now, MSc Global Public Health, as a nomenclature, it is delivered from last year. Before that, we used to deliver the same program as MSc Public Health. Before that, we used to deliver the same program as MSc Public Health and Health Promotion. Before that, there was other nomenclature. So don't go on with the name of what, but what I'm trying to say here is, like, we have a history of delivering the public health program for more than 30 years, that is undergraduate and postgraduate program. So we have got quite a lot of experience in delivering that program, and that is what has made this program very, very successful within Canterbury Christ Church University, as well as in the local regions. Now, getting further, I mean, many of you will be asking, then what is the entry requirement to get into the course? And one of the key entry requirement is you would need to have a first degree. The first degree, where I say it means, like, you need to have an undergraduate equivalent degree from wherever you are coming from. Of course, if you don't have a British undergraduate degree, which I'm expecting most of you will not have, but we need to have an undergraduate equivalent degree. So if you have done BSc from any South Asian countries, then that will almost be equivalent to undergraduate degree at in the United Kingdom. But I'm sure our colleagues will guide you for that equivalency and other things. So that is one of the key requirements. The other requirements is to meet the requirement for the international students in terms of English language. Again, many of you will be aware, and our English language requirement is overall a score of 6.0, and no elements should be below 5.5. But there may be some alternatives. Again, the admission team can help with that one, with the requirements. But this is our basic requirements. Also, I mean, the pictures I'm showing you is part of our Canterbury Christ Church University, and this is one of our new building, which is sort of like the home for medicine and health courses as well, will be run in there as well. So brand new building for us. Now, in terms of MSc Public Health at Canterbury Christ Church University, we have been sort of like received always, most of the time, the positive feedback from our students. And I have got this integrated video, and I will try to play it. And if for some reason the sound is not audible, do let me know. And then this can be accessed on our MSc Global Public Health webpage. And there are these videos, so you can watch it there. But I'll try and play this. This is a couple of minutes. So let's see. So could you all hear that? Can anyone confirm that from the organizing team? Could you hear that voice, please?
No, Rajeeb.
No. So it looks like
the audience. I think the audience might be able to hear it. Yeah, I can see. Yeah, the audience is saying yes, it's audible.
Oh, okay, that's fine. Then I will play it then.
Okay. Sure.
Okay, that's fine. Thank you.
Sorry, Dr. Rajeeb, I think there was some audience members that were not able to hear the video. So if maybe you could just give a little bit of background of what's actually the content.
Yep. So yeah, this was, I'm sorry for those who were not able to hear the voice there. I've not seen any of the messages, but I'll just give the context of what the video was. The video was about how we are here to support our students in most of the cases. And they were talking about the support they have received from the lecturers, from the university on our course, and from the university itself. So that was the key part of the content of this particular video. I mean, you can visit our website, and these videos are integrated within our website, so you can always watch them in your own time. So that will be the best way to do this. But yeah, I mean, the key point I want to highlight is like, we are here to support our students, and that is our prime focus. And that's the reason we have succeeded in developing this course, which is quite popular, and we have received quite a sort of like a positive review as part of this program. You can see that those students were from the public health. As I said, like they were the previous area students, but now we have renamed it as a global public health. So we are branding it now as a public health is not only about a certain country, but it is about thinking about the health aspects of the global citizen. And that is at the center of what we are teaching at the moment. And that is important in all aspects. So as I said, like we are trying to reach into the global remit, and that is the key. You can see that sustainable development goal, and I'm quite sure most of you will be aware of that. So most of our modules, what we teach is shaped by the sustainable development goal. And if you can see on the left-hand side, then you can see like we have got a compulsory module, and that is 4 compulsory module. And then we have got some optional modules. So out of the optional module, every student will be allowed to select 2 or maximum 3 modules. But you can see the variety of modules that we have got. Modules about sustainable development goal, about global healthcare system, about migration, culture, and health, which are the key source of like issues around global health. And that's the reason, again, this program is quite highly valued at the moment. And this year we have been delivering migration, culture, and health, and environment and health, and they have been quite popular modules among our students. So I'm sure that you will see these modules and you'll say, oh, this is a good module for sure. Now, in terms of job opportunities, it's about like following what you really want to do, and global public health or global health is about the interdisciplinary aspect of what you learn, and that's the reason there is various way where you can shape your career in. I mean, one of the area will be, of course, looking for the global health jobs in terms of like supporting sustainable development goals, or doing any jobs which relates to the global health inequalities or tackling global health inequalities. And there are loads of sort of like national, international organizations that are working towards it, and that is one area where you can find a lot of job into. Another area is global public health policy and research. I mean, I'm sure many of you will be aware of many consultancy works that is going on in terms of like public health evaluation of certain programs, and that is where you can build your career in terms of like research and policy, and that is another one. The third one is about health protection, and I think that is quite relevant and very important in the current time. And with the COVID, especially in the United Kingdom, I think health protection job is one of the prime source of like target for the public health graduates. And I think that is going to be the case around the world in public health, where health protection and public health intelligence will be getting more and more job opportunities. And that is what we touch on our program. So we build career inside that one. Then there are other career around commissioning public health services in terms of like physical activity, sexual health, smoking, drugs, alcohol, housing, environmental health issues, and all those areas that can be related to commissioning or independent as well. And that is what you can learn as a result of this program. And then most of the important area is international development sector, where we know that there are various international sectors which is working in developing world, and they are doing projects about education, about health, about human rights, social justice, and migration. And those are the areas we try to equip you to prepare for, where you can get the job in. Charity work and non-governmental organization, as I said, that can be one of the routes you can take in. And then at last, I mean, you can always look for further studies. Once you have completed your MSc degree, you can look for the doctorate study, and then you can complete your PhD degree, and then get into the academia, like I did, completed my master's, PhD, and then I'm in academia now, and full-time academic researcher and teacher, and I love this job. So there is wide-ranging job opportunities which you can get, and then you can just decide where you want to go. We provide a lot of guidance on that, and we try to discuss with the students of how they can build their career in. We try to integrate as much as we can, but of course, I mean, it is the students, they need to show their intention, and then we support on the basis of that. We also have sort of like some form of awards in terms of like, once you complete your dissertation, then we have David Steers Memorial Prize. So the best dissertation on that academic year will get this prize. Monetary value may not be quite high, but in terms of recognition, this is how we recognize the excellence in our program. And this is one of the example. In 2018, we gave this a student, I think she got about 80% in her dissertation, and then she was awarded with this one, and I'm sure that this has helped her in her career, demonstrating the academic excellence she brings with herself. So these are some good things. Lastly, I mean, life after graduation can be different, and this is one of the video from our alumnus student, but I'm not going to play this because as some of you were not able to hear this, I will suggest rather, please go to our cccu Global Public Health website and look at all the course content, and there is these 2 videos, which I played one, and this one, second one. Please do look at it, and then you will get a sense of like what our graduates are doing. She completed master in public health. I was her supervisor. I supervised her dissertation, and then currently she is working in a volunteering sector, and she is doing great. She was nurse by profession, but now she has got this drive of working in public health, and she is doing great. I'm still in contact with her, so I can proudly say that she has been one of the good public health graduates I know. So yeah, well done to her. So this is a little bit sort of like a tester for you of what global health is and how we do study, how we prepare our students in our university supports we provide. But I'll be quite happy to take the remaining 40 minutes to answer any of the questions that is with you, and then I will try to answer as much as I can. Thanks. That's all, Semyon. I will stop sharing them.
Okay, thank you so much, Dr. Rajeeb, for that. Very, very informative. I can see we've got some questions come in, and also for the rest of you that haven't, please feel free to start sending them now so we can go through them. So firstly, I fully apologize, my pronunciation is probably horrendous, but we've got a hello from Kabita Kanal, a hello from Nepal. That's for you, Dr. Rajeeb. And let's see. There's a question here. Can the university offer pre-sessional English program for those students who cannot qualify for IELTS? And that's from Wasim. Wasim, yes, the university does offer pre-sessionals. So please make sure that you get in touch with your consultant and they can inform you on further details on this. I know there's quite a lot of questions around the webinar. Yes, once the session is finished, you will be receiving a copy of the recording. And as Dr. Rajeeb said, for the videos, please make sure that you check on the CCU website. Next question from Sador, I think. After graduation, can we work in international relation jobs?
Sorry, I was just trying to find the link.
Yeah. That's fine. So the question was, after graduation, can we work in international relation jobs?
The short answer is yes, because we are preparing you for international, interdisciplinary masters, and international relations is one of those areas. Now, international relations is very, very wide. So what parts of international relations are you talking about? So international relations can be from sort of like political international relations, where you talk about the political policy, from the health policy, and on the other side, it can be health policy. So if your international relations is related to health policy and health research, then of course, this course will prepare you for that. I mean, in my introduction, one thing I didn't say was like, I have also completed postgraduate certificate in international relations and globalization. So globalization is one of the central components of our master program. And I think international relations is very much integrated with that one. So yes, we do prepare you with the international relations aspects in terms of like migration, in terms of like sustainable development. So those are the areas which touch very nicely upon the international relations issues. So yes, definitely you can work in that sector. Perfect.
So this is from Chucks. What are the basic admission requirements?
Mm-hmm. Yep. As I said, the only and the key requirement is you need to have completed undergraduate degree. So if you have completed undergraduate degree in your country, and if that is equivalent to United Kingdom undergraduate degree, then that meets the criteria. And I think that should be all. You just need to meet that criteria. And then of course the English language is the added one. But as Semyon highlighted, there is pre-sessional English language course. So you can come through that route. For the program, if you have done undergraduate, that's enough.
Mm-hmm. Thank you. This is from Sybil. Can a nurse with the National General Nursing degree be considered for this program?
Nurse, I mean, I always get confused with the nurse one. So nurse is like, there is a staff nurse, which is equivalent to the intermediate degree, and that doesn't qualify to the bachelor level qualification. But if you are a nurse who has got a proper BSc in nursing, which is, I think in South Asian countries, Nepal, India, Pakistan, I think it is a 4-year course. And if you have completed that 4-year nursing course, then yes, you do qualify for that. But again, I think it relates to the requirements. If it meets the undergraduate degree equivalence of United Kingdom, then that should be fine. And I'm sure that our colleagues in the agency, they will be able to help you to make sure that you have got that level of qualification. If not, they will guide you and they will tell you why it is not required. One thing I just want to highlight, like, is that many of the people will not be from the healthcare sector. So if you have done BSc in, let's say, I don't know, BSc in computing science, and still you want to do the healthcare, still you can do MSc Global Public Health, because as I said, like, we bring in interdisciplinary. So even if you have done BSc in nursing, if you have done, BSc in engineering, or BSc in computer science, or BSc in, I don't know, commerce or something like that, still you will be able to join the MSc Global Public Health course. It just need to make sure that you have got the undergraduate equivalent UK degree.
Thank you so much for that, because it kind of leads to our next question from Alvita, where can students from any background apply to this degree? What are the entry requirements? But I think, as you answered, any background, as long as you have an undergraduate, you are able to do global public health. Okay, moving on to the next one. After graduation, can we work as a hospital/healthcare administrator? And this is from Barbara.
I don't see a reason why not, but if you are trying to refer to, there are certain courses which is specifically for hospital administrator, and I know that there are masters in hospital administration. So we are not the course of hospital administration per se, but in hospital, of course, global public health or public health can play a role, an excellent role or a big role, especially in the health protection arena, which I was talking about. So if it is about the risk assessment of how sort of like hospitals should be managed in terms of like where they should store the needles and other things, so those aspects can be fulfilled by completing the MSc Public Health or MSc Global Public Health course. So how I want to answer this question is like, yeah, not specifically, this is not the MSc Hospital Administration course, but by doing MSc Global Public Health, I don't see a reason why you cannot work as a MSc as a hospital administrator.
Perfect, thank you. So this is from Rakesh, the duration of the pre-sessional English courses. So Rakesh, there's two. We do a 10-week and a 6-week session, and they are really dependent on what your requirements are with your English, what your grades are, and that will only be decided once your documents have been received by the admissions team and they've been able to make an assessment on those. So again, please do get in touch with your consultant and they should be able to give you further information on this. Thank you. Next, this is anonymous. What kind of organizations / companies are students getting employed in after the degree?
Yep. For the national students, so those who sort of like are willing or who stays in the United Kingdom, for them, most of the organization will be our local councils, or there will be sort of like charity organizations within the country. So if I take an example of the local organization, then we are in Kent. So this is United Kingdom in England, and we are in Kent. So in Kent, we have got Kent County Council, who has got the public health team, and then another is Medway, and they have got the public health team. So most of our graduates, they go and work for that two organizations or some local charity organizations within this region. So that is one. So that is the national one. Now for the international one, we have got quite a few number of students who are working for United Nations or WHO, or they will be working for some sort of like a migration charity who is working internationally. There will be, so any form of INGO who is doing some work related to poverty, health, education, you will be able to qualify for those jobs. So these, I mean, the skills what we develop as part of this course is interdisciplinary and transferable. So that can be used in any part of those jobs. So any international organization which you are thinking of after doing this master, I'm very pretty much confident that you will be able to work with. The reason I'm saying is like, because all the international projects have some angle of education, some angle of health, and some angle of poverty eradication or poverty tackling. So that's the reason we are touching on those sustainable development through the sustainable development goal, and you'll be prepared for that.
Thank you. Let's see what's the next. Chucks again. Considering the scope of the program, any internship opportunity is part of the program?
Okay. What I will say is like, as part of the program, we do not have any compulsory internship opportunity. Okay. So as a part of the program, we do not provide any compulsory internship, but we do have one of the module, which is called work-based learning module. And as part of the program, a student can identify some volunteering places where they want to work, and they can use the learning from there for the part of that module. And we will support students in developing their sorts of like skills within that organizations. Also, we are trying to, and I'm saying it again, we are trying to create a database of sorts of like local organizations, which we can share with the students or ask students if you want to find out if there is any opportunities or not. But I want to be very clear that, yeah, as part of the course itself, there is no internship opportunity as per se, but we will support our students to look for it and do it as part of that particular module.
Perfect. And this is Barbara. Can a BSc Business Administration be considered for this program? So I'm assuming, yeah, BSc.
Yep,
yeah. So yeah. So
yeah.
Okay, perfect. Simple Sharma. If a student have completed graduation in 2013 and after that she has experience as a staff nurse, can she apply for the same?
Yes, I will say, and I'm taking time to think, because in 2013, did you mean you have completed the bachelor degree or not? Because that is the key part. If it is your degree is equivalent to undergraduate, then yeah, that meets the criteria. And as you have got the staff nurse sort of like experience, that is an additional value that will bring to the course for you and for us. So definitely you qualify for that.
So this is Sybil. What is the study load compared to the personal workload during the program?
Okay. Now, master degree in United Kingdom in any university, it doesn't matter which university you go, it's very, very intense. So we have got 3 trimesters. The first one is from September to December. Second one is from January till April or May, and then summer term. It's very intense. Now, for every I'm trying to put it in a right way, so that I don't. So for every 1 hour of contact time, you will have to spend about 4 hours of your independent study. So in one term, as most of you will be full-time students, so in one term you are studying 3 modules, and one module is equivalent to 200 hours in total. So that means you will have to spend 600 hours in one semester, in one trimester, and that is from September until January. So now you can make your calculation yourself. If I want to tell it in very, very simple language, then I will say it like this. You will have a session. Our session is normally 3 hours face-to-face session for each module. So you will have 9 hours of session face-to-face. Then you have 6 hours of compulsory reading as part of your preparation. So that is 15 hours. And then remaining hours, sort of like about 20 to 25 hours, you will have to do independent study to meet the requirements of that 5 hours of what is sort of like supported teaching. So per week, you will have to study about 35 to 40 hours. So that is the intensity of the course. Okay.
I'm going to just move over to questions because there's quite a lot of questions. Thank you, everyone. So I'm a dental surgeon. So can I join? Is it beneficial for me?
Yes, you can. Definitely you qualify for that. We have currently I think 3 or 4 students who are dental, who have completed BDS. You are saying dental surgeon. So I'm assuming you have completed BDS, not MSc in dental surgeon or something like that. So after BDS, yeah, we have got 2 or 3 students and they are doing their master degree. And I'm pretty confident they are doing it because it is helpful for them and they are very happy with the course.
Perfect. Is there any interview of the student? And this is from Gurmeet.
No, we don't interview. If you meet the criteria, you just need to apply for it, and our admission team will get back to you if they need any further information. I mean, in exceptional cases, we might have interview, but in normal cases, we don't.
Gurmeet, the only thing I would add to this is the only interviews you'll be attending is for your suitability for the universities, and plus there's a pre-CAS interview that you'd have to attend, but these are not linked to your academics. It's more to do with your suitability around your CAS. But again, your consultant will be able to explain further about them. I've got here, hello, this is from Manoj, I think. Hello, I'm from Nepal and university had provided me the conditional letter. I have a gap of 7 years after my undergraduation and had job experience related to the public health in INGO's NGO sector. Please clarify, can I get chance to get the offer letter unconditional and visa? I think looking at the background, it seems like they have the background for the academic, right?
I mean, the only what I can sense from what Manoj is saying is like his conditions should be about English language. That is the only thing what he has not written there. So we need to look into what is your condition. Now I know your name, so I can check the database. What I will say is like, drop an email to the admission team. You can copy me. No, you can't do that. Is that right? I'm sorry,
no, I think no, it's fine. I think that the admissions team will be able to reply to this query. So we'll follow up with you, Manoj, and be able to get back to you on your application and just let you know where you stand with it. Will Canterbury support students if they wish to transfer to universities in USA or Canada?
We don't have any link per se for this particular course, I will say. And I think this is a 1-year course and this is 1-year intense course. So I think transfer doesn't fit anywhere.
Okay. So this is from Chetali, student graduate in microbiology in the year 2013 and till date having work experience in laboratory. So is student eligible for MSc Public Health program?
Yes.
Yeah. I think we're going to get a lot of these questions. And guys, I just want to apologize from now. I'm sure my saying of your names is not correct. Do apologize. So we've got Javantika. Do we have chances to get experience from UK public health institutes?
Yes, and this is what I was highlighting. There is an opportunity. I will be very clear that it is very much a student role, and the good students, they always look for opportunities, and we as an academic provide the reference, we provide the support, we can provide the information where they can look for these sorts of opportunities. But as a part of the program, there is nothing compulsory. But as a sort of like outside the program, if you will speak to the tutor, they will be quite happy to provide the guidance and the pathway where you can get experience from the public health workforce within the United Kingdom, and that can be an asset. As I've said earlier, you can always link that. If you get that opportunity, you can always link that to one of the taught modules as well, which is an added value in a way, I would say.
And I think this is a kind of a continuation of the question. So someone with a microbiology degree, can they use it to work in a hospital?
I mean, again, I couldn't understand. Well, with the microbiology, of course, you can work wherever it's at. But with the added value of global public health, Yes, you can work in the hospital. It depends on what role you are trying to work there. In hospital, there are many roles which is mostly related to the health protection, where our graduates will fit in very, very well. Someone asked about the hospital administrator. Again, that is another role where you can fit in very, very well. There are very much research-focused hospital setting as well, where they have got a lot of research work that is going on as part of the hospital environment, and you can fit in very, very well there. So of course, with our MSc Global Public Health degree, you cannot work as a clinician, but you can work in various other parts of the hospital setting for sure.
Thank you. And this is from Shoaib. The admissions requirement is 2.21 first class degree. Is there any possibility to apply with a 2.2 second class for MS Global Public? Is there any work experience required?
As I said, I think for the international students, there is two screening, what I'm seeing here. One is by the pre-screening for the CAS, and I cannot say anything about that because that is done within our colleagues, within our other team. So I will say, please speak to the colleagues or the consultant there, and they will be able to explain whether you meet the requirements or not. As I said, like the requirements per se for our program is undergraduate degree, and we do not have any sort of like band qualification, but still, I think it depends very much on everything other things, what you have got. So I'll leave it for the screening team to do.
Okay. So how about the percentage of CGPAs required an undergraduate degree to study MSc Global Public Health for Nepalese student?
Again, this is the same questions in a different form. As I said, like speak to the consultant, and if you pass the pre-screening, then I'm sure there will be no problem for the for our course to offer you the letter.
Okay, this is from Ali. I think Ali's asking, what is the most popular background, qualification, or profession for an MSc, like medical doctor, etc.? And I think he just wants to get an idea of what an ideal applicant would be for recruitment purposes.
Yep. So there's two groups. First is the national group. So most of our national students will be from some form of allied health background. So whether they will be either nursing, they will be from the OGP, they will be from other physiotherapy and other things. From the international candidate, most of our international candidates are either medical doctor or they are the dental doctor, BDS, they have completed BDS. Some of them for this academic year, we have got who has done their pharmacy as well. So I think there is a widening of the areas from where our students are coming. Yeah, I hope that answered the questions. Also, I mean, most of them will be health sector. There is flexibility.
Yeah.
And we have started getting students even from sometimes from the business background, sometimes from the art background, and there is again a very good connection between art and health, which we try to highlight within our program. So the more disciplines we have got, the better our program is, and that is the nature of interdisciplinary, multidisciplinary program, which we are proud of.
Okay, so this is more for my sake, so to hijack a little bit of the questions that Rajeeb. So if someone is coming from an arts background, they've done an undergraduate, is it the case that they have to show why they've decided to pick this course? So they have to show a relation, or is it the case of just having the undergraduate is enough for them to be able to get on the course?
Of course, to come on this course, there needs to have some form of passion. Why do you want to get into the health? And that's where they will be writing the covering letter explaining why they are interested in this course. But if they have got the undergraduate, that fulfills the university criteria for the admission. But if they are motivated enough or not, that is what will be determined for the CAS purposes. I mean, if someone they just want to do some course, then possibly then MSc Global Public Health is not that course, I would say. If you're passionate about health, if you have done art and you think like you have something to bring to the MSc Global Public Health or public health per se, then definitely this is the course. I hope that makes sense.
No, that does amazingly. And you also kind of, you know, when it comes to the suitability interviews, it is very key that students can show why they've diverted,
Yeah.
and
Yeah.
they would have to show that in their personal statements. They also have to be able to explain that in their interview, because it's not only the university that will be asking, but also when you're applying for your CAS, when you're attending UKVI interviews, you have to show why you've decided to go from one stream of kind of study to another. So it's important. All right. So how long is the program, firstly? And secondly, is there a possibility to progress to MPhil or a PhD?
Yeah. Yes, this is a one-year program. So yeah, this is a one-year program. After completing MSc, you can definitely study PhD at the same university or the other university, depending on what you want. Yeah, I wanted to expand a little bit. I mean, again, I mean, if you are very much passionate about that, then again, you need to speak to the colleagues when you are studying masters, and they will always be open and happy to support you to develop your PhD proposal as well. But again, I mean, it needs to be taken into account that you have got intense master degree to complete first.
And there's a question from Sado. Students while studying, can they work in public health? I think that's probably more to do with time availability. Yeah. So how consuming is the course, and would they be able to work at the same time?
Yeah. I think as I said, like the best way to work is, as I said, is about like to fit it within the part of that particular module I was talking about, work-based learning, which means like you'll be doing one less module, but at the same time, you will be able to get some experience as well. So it is about planning, but again, I mean, to do that module, you need to be proactive to find the internship opportunity or to find any volunteering opportunity yourself. We as an academic, we as a team, we will guide you, but then we want a student to be proactive in finding those places. If we force you to go and work there, you will not do that. So that's the reason we want a student to be proactive. But yeah, we provide all the guidance.
Can I just ask, how easy has it been in the past for students to find placements?
This is part of our new program. As I said, like we have been running public health program for quite a few years, but MSc Global Public Health program is started this particular year, so 2020. And that is where we introduced this work-based learning module. So this is just 1 year. Unfortunately, we are in COVID period, where any sort of placement comes with a lot of risk for the students and for the staff itself. And that's the reason this year we have suspended the work-based learning module because of COVID and the risk, because we want our students to be safe, our colleagues to be safe, and everyone to be safe. And that's the reason we decided like this is not the right time to do placement. I mean, in UK, we are still not allowed to go to our workplace. I'm working from my home. Yeah. So there is no way that the placement was possible as in the normal times, and that's the reason. But I think, I mean, coming year, hopefully we'll be in better situation and we will get more placement. But I would just like to highlight this one. Although we did not have the work-based learning module before, I know that there had been quite a few students who have gone for placements, who have found their placements. I know this because I have written reference for them. So as a program director, I do write reference for them, and they have been to that. We do have discussion within the classroom. We do invite our guest lecturers, and the guest lecturers are working in the local sort of like public health area. And that is another way of networking with those people to find out the opportunities. So it all depends on various things. And the most important thing is like how proactive the students are.
And it sounds like there's quite a lot of support, especially if you're writing them a reference. Having probably a reference from you probably gets them much further than them kind of just going on their own. So that's good to hear. Florence, please, can a person with BSc Mathematics Education offer this program? Join this program. So I think, Florence, this has been kind of answered. As long as you've got an undergraduate and you can explain why you decided to do global public health, that's kind of meets the criteria. Okay. So Sadiq, what is the role of a person with a basic veterinary medicine in studying global public health? Sadiq, I'm not really sure about that question, so maybe if you could try clarifying that for us, that'd be great. Sybil, how large are the classes, or how many students are expected in this program in September?
that depends on various factors, isn't it? I mean, one is how COVID will be and how much people will be able to travel. But all I can say is like we do have a manageable size, I will say. I mean, normally, I mean, this current academic year, we have got 21 students on our cohorts. For the current year, for the next academic year, we are expecting about 30. So hopefully that will be about the average side, but I will not promise anything. It depends on various factors, I will say. But I think our student numbers should be around 30, not more than that, I will say.
Mm-hmm. And this is from Afia. I'm a physician assistant from Ghana. Do I qualify?
Physician assistant, again, I'm not quite sure what level is that. I'm assuming that is equivalent to MBBS, or I'm not quite sure. So again, if it meets the undergraduate criteria, then yes, you qualify.
I think for a question like that, Afia, it might be more helpful for you to get in touch with your consultant, so they'll be able to kind of look at the documents you have and your qualification, and they'll be able to kind of direct you much more better than what we can do without looking at what you have at the current moment. Let's see, and this is from Nikita. Could you please tell me if I can join in the PG psychology course with having no background in psychology, as I'm a sociology graduate?
I'm sorry, I can't answer that question. I can definitely say you can join Global Public Health if you're interested. For psychology, I think you need to speak to the psychology team, unfortunately.
Yeah, I think, Nikita, again, with a question like this, it's a definite good idea to get in touch with your consultant. They'll be able to tell you exactly what the requirements are for that course, and what you need to do to be able to apply. We seem to have gone through quite a lot of questions. Are there any more questions? I've got one here, Nicole. Is there any criteria for the student to get a job placement after completing their program in UK, like with the scores or projects completed during studies? But I think we pretty much have answered that question. And I think we've done that. I think it's pretty much been kind of the same questions. Any more questions from anyone? I know there's a couple of questions here with regards to deposits, scholarships and so on. Please do get in touch with your consultants. They'll be able to tell you the specific information for your circumstances. Yeah, there's quite a lot of questions about scholarships. So again, please do get in touch with your consultant. They'll be best in place to answer all your questions with regards to this. Sorry, this is a question that's coming. What salaries are students getting paid by working at the councils, etc.?
That varies again. I mean, it depends on if you're getting into the introductory level job, or you have already got the sort of like wide experience. Like, I mean, some of the people here, they were talking about they have got quite a few years of working in international organizations. And that means like they will have an added value when they will come to work here in the council. So it very much varies, and I think the salary can be anywhere between 20,000 to 40,000. I will say. I mean, it's very difficult for me to answer that question specifically. It depends on your interest, and it depends on like what role you are trying to get into.
Mm-hmm. I think it's kind of a twist on the same question from Sadiq. What are the possible job opportunities across the world? I know that's kind of something you've answered, but yeah, that's coming.
I mean, again, I can just highlight, I think the one point I want to highlight is about like, which I've touched on various points, is like, you need to ask yourself why you want to do MSc Global Public Health. Mm-hmm. And if the reason is that you want to work for certain areas or certain sectors, then that is where you will find the answer of where the role will situate. As I said, like MSc Global Public Health is an interdisciplinary program. And if you are thinking of working in international organizations, it will basically give you the opportunity to work in any form of organization, international organization. I will be quite surprised if, I'm sorry for my kids.
It's okay. It's the new normal, Dr. Rajeeb.
I'll be surprised if any organization will say that, oh no, MSc Global Public Health, we don't take that candidate. So it depends very much on your own interest and where you want to situate yourself. I mean, there are many people who will complete the master program and they will get into academia, where basically they will start teaching health and social care programs. And again, that is not the public health, proper public health job, but again, you are teaching health and social care. So it depends on what your interest is and why you are trying to do MSc Global Public Health. And that's the most important part. You need to ask yourself, put it on your CV or in your covering letter, so that we can provide more support on that, because of course we'll look into it and we'll see how we can save our students in a better way.
Mm-hmm. And to add to what you were saying, Dr. Rajeeb, you know, when you are going through the process of going through your suitability interview, or whether it's your pre-CAS interview, or it's even your interview with UKVI, it's very important, especially when you're doing an MSc like Global Public Health, that you have kind of an almost clear idea of what you want to do with this qualification. What does your future look like? You have to share that on your personal statement. You have to share that in your interviews. And also it will overall help you with what you want to gain. So you do need to have an idea. So you do research on the kind of job you want to look for. Do some research on what qualifications they need, if the modules match what you're you know, looking to work in. The more information you have helps you in your interviews and also helps you in your future plans. So do as much research and due diligence. I can see there's still loads of questions about whether BSc Health Administration or specific backgrounds will be able to get you in. And so again, or what kind of job it will get you. And I think it's like Dr. Rajeeb has said, you know, do the research. Does this fit what your plans for your future are? Because these will be questions that you will be asked as you go through your application process. Okay, and the last questions we've got, am I too late for the September intake? And I can tell you, you're not late, but I would urge you all to make sure that you put your applications as soon as possible. We are slowly coming closer to our application deadline for this September 2021 intake. So I would not dally. So do make sure that you at least put your application form in. Do get in contact with your consultant, your student advisors, and they will let you know what the next steps are. But I would make sure that I would not leave it for too long. These are very, like, Global Public Health is one of our popular classes. So do make sure that you, do what you need to do. So I think that is it. We have come to the end of our time. And I just want to say thank you so much, Dr. Rajeeb, for your time. I feel like I've learned a lot here. There's a lot to take in. And thank you so much for everybody that's joined us today. Loads of amazing questions and they're still coming in. So not to worry, we will be answering your questions following this session. We will also be sending you a copy of this webinar. And also because your consultants will be getting in touch. So a lot of your queries will be dealt with. And again, Dr. Rajeeb, thank you so much. Is there anything that you want to add before we go?
Yeah. Just I want to say thank you very much, everyone who have attended this session. And I hope you got some important information that will shape your understanding. All I want to say is, like, make sure you look at our website to get more information about the course. I mean, if you have got any academic queries, and I know I'm opening the can here, but if you have got any academic queries, you can always
be very careful,
me.
Dr. Rajeeb.
Yeah, that's what I'm saying. Opening the can. So yeah, so don't start emailing me all the time, because they will take care of that. But if there is any academic questions you want to ask, then I think you can find my contact on the program page itself. I don't mind, but as I said, I'm not going to respond to any queries about anything other than proper academic questions. But so please contact our agents who are there, and they are there to help you with all the other stuffs like entry requirements, scholarships, timing, and all the other things. If there is any specific burning questions about academia, then you can always email me.
I would just add a little bit to this, Dr. Rajeeb, just to save you a little bit. please make sure that you check with your consultant first before you think of contacting Dr. Rajeeb, just to make sure that you do get, this is just to ensure that you get the information that you do need. So, and I can see loads of people are saying thank yous. So again, Dr. Rajeeb, thank you so much. And thank you so much everyone for joining, and yeah, have a good day. Bye.
Thanks a lot. Thanks. Bye-bye.
Bye-bye.